My name is Bob Voelkner. I'm the Vice President of Sales for LabVantage Solutions. Just a little background on myself. I've been in the LIMS industry for over 37 years. My background is I'm a computer scientist. I actually started developing software early in my history, focusing on LIMS systems. I was actually part of a team that created the first commercial LIMS solution way back in the 70s. What was interesting about that time is this was before the Oracle Corporation, which makes database technology, even existed, and Microsoft had not even formed its company yet when we were writing this software. So the computing technology in those days was quite different. And I try to explain to some people now that when you write software in those days, it had to run in a 32K partition. That's not gigabytes or megabytes, that's 32,000 characters, and you had to be very careful about your software development skills. So the very early days of the LIMS development. Since then, I've actually held a variety of different positions in developing, delivering, validating, supporting, and marketing and sales, obviously, for the informatics marketplace. And I've been with LabVantage since 2009. I actually became part of LabVantage through an acquisition. So for our topic today, we're going to focus on data integrity and compliance with computerized systems. And the little introduction, obviously the pharma space and other adjacent industries like cosmetics, food and beverage are all subject to regulatory constraint. These are companies in highly regulated markets that are required to comply with government regulations, standards, and guidelines. There are rules in place that have been designed to ensure the safety and the quality of the products that they manufacture and that we eventually consume, as well as all the security and integrity that goes around working with the production of these products. The FDA introduced what was called 21 CFR Part 11. This was quite a while ago. This was back, I think, in the 90s. And it was intended to regulate electronic records and electronic signatures that were used in several industries at the time, but primarily pharmaceutical manufacturing. And as a provider of LIMS in those days, this was an exciting time because this was really a wake-up call to start focusing on computerized systems, putting constraints and controls in place, validating systems correctly, and then focusing on data and the retention of information that's being generated during the manufacturing process. Additionally, the EU also introduced Annex 11, which also covered computerized systems in the pharmaceutical manufacturing product of medicinal products. So the early days of lab automation were being constrained and also driven by regulatory constraints and pressures. We're going to be talking about data integrity, and if you're in the industry, data integrity is something that's probably something you know about, you've heard about, you might be concerned about. Again, as an informatics provider, we're excited about it because it's an ability for us to really show our value to the space. This is a few quotes that I took from a statement that was made by the former FDA director. He just recently resigned and left office. But obviously, overseeing the quality and the safety of pharmaceutical manufacturing is a key mission of the FDA and also as well as other international agencies. Drug production and the testing operations have to become computerized to be able to handle very complex supply chains, global operations, and really what's becoming not a simple process to manufacture a product and bring it to market. There are policies and guidelines that the FDA has put into place that have evolved over time to ensure the quality and standards are being maintained. And the overall goal in the charter, obviously, of the FDA is to ensure that the data associated with all drug manufacturing are complete, consistent, accurate, and therefore very reliable. The director also went on to say that in recent years, the FDA has been observing an increasing level of observations in CGMP violations. Many of these, of course, get documented in 483s and other filings, and a lot of them deal with data integrity problems during inspections. Data integrity problems that are identified during these inspections are documented in warning letters and other regulatory actions. As he indicates, and we've seen this as well if you monitor the 483s, The data integrity concerns in some cases are coming from deceptive practices. So this is a falsification of records on a purpose to maybe hide an issue or a production problem or a quality problem. More commonly, and that's not really the typical case, but more commonly though, it's really inadequate processes. What they're finding is the processes and the systems that are in place to ensure reliable and accurate data are not in place. And they're finding violations and issues there and writing up warnings. Therefore, patients can't always be assured the safety and effectiveness of their medications when the data has been altered or mishandled. So this is sort of the background from the FDA's perspective on data integrity and why it's in place. It's a really well-written statement. You can Google it and find it on the web. From our perspective, data integrity is becoming a big issue and has been now for a number of years because regulators are focusing a lot of resources on this particular effort. Their goal is, again, to prevent, uncover, and combat any sort of data integrity issues. So in 2016, the FDA issued what's called a draft guidance. In this case, it was on data integrity and compliance. And when this was issued, it was sent out for public comment. Obviously, we saw this initial draft guidance, reviewed it, and as we had an opportunity to meet with a lot of members of the pharmaceutical manufacturing industry. About 60% of our business is in the pharma world. And so we actually met face-to-face with our clients and reviewed the rulings and the guideline to find out if they felt comfortable that we're still able to maintain and cover what they need. We did find an area that we actually had to improve at the time, which I'll talk about in a moment, and how we actually improved it. Since then, late last year, the final guidance was then issued. So based on public comment and feedback, the FDA came out with a companion document, which is called the Data Integrity and Compliance with Drug CGMP Questions and Answers. So this document basically adds clarity to the initial draft guidance. It actually helps explain what the approach is and what the FDA would consider acceptable practice for data integrity within the laboratory. So these two documents together make up essentially the FDA's position on data integrity. Just so happens at the same time in the UK, their regulatory agency was also issuing a new document called GXP Data Integrity Guidance and Definitions. It's largely in line with what the FDA came out with as well. In fact, of the two documents, I kind of prefer the UK version. I think it's a more verbose and complete covering of the particular issues of running in a compliant environment with computerized systems. Other agencies have also followed suit. The EU, as well as the World Health Organizations, also came out with either brand new or updated guidances on their own as well. So obviously this is getting global coverage. This is not a US FDA initiative. This is a global concern across the board, since most of the organizations that manufacture pharma products are global in nature. So let's first talk about what is considered a CGMP record and when does it become a record that needs to be controlled. So we can first talk about data. Data actually on its own is not enough of a definition. So if I put up on the board here the number 4.2, none of us would know what that means, right? There's no context around that number. So results and data have to include metadata, and the phrase metadata is basically it's data that describes data. So I took that number 4.2 and I added what unit of measure it's measured in, and if I know what analyte or parameter I'm actually measuring, and if I know what lot and batch it came from, then at what stage in the manufacturing process, who the tester was, what the date and time was, what instrument did it come from, what reagent and chemicals were used in the process. That metadata now puts a lot of context around that number 4.2. And it actually fully documents what it means, and at the same time, it's letting me be able to treat that as a record. Now, the FDA says data, in the context that I've just described, it's not acceptable to just record this on a piece of paper and then be able to take that piece of paper and then record it into my system of record, whether it's a spreadsheet, an electronic notebook, or a LIMS system, and then discard that piece of paper. So as soon as it's documented on some sort of durable process, it has to be maintained as a record. So if I'm in the lab and I read a result off a pH meter, let's say, and I write it on a piece of paper, that piece of paper becomes a record at that point. Therefore, you got to document and save the data at the time that it was performed. So as soon as the result is derived from the instrumentation, as soon as it has been made available, that is a record at that point that is then subject to proper CGMP record keeping. And the FDA expects processes to be designed and in place in your labs so that data required to be created and maintained cannot be modified without a record of modification. So as soon as it's on a piece of paper or in a spreadsheet or somewhere else, it has to be under control. And if I make a change, there has to be complete audit trailing and other documentation in place to record that information. Now, as outlined in the latest guidance, it's not acceptable to store electronic records in a manner that allows for manipulation without creating a permanent record. And I'll explain a little bit more what that means in a moment, but essentially this is an actual quote from the guidance itself, and it's quite important. And this was one of the areas that when we started to look at this and discuss this with other pharma companies, some people became a little concerned that maybe we didn't have a complete solution for them and that they had to maybe rethink about how they were maintaining records. And let me explain what that is. So there's a term called temporary memory, and it was actually spelled out pretty nicely in the draft guidance. In electronic terms, when data is captured, before it is stored on permanent media, and permanent media means something like a database, as an example, that's called temporary memory. All right? So electronic data that's saved into temporary memory doesn't meet the definition of CGMP documentation or retention requirements because there's no auditing, there's no control, there's no reliable information, there's no integrity about that result because it's in a temporary state before it actually gets saved to the permanent media, in this case the database. So in its temporary state, that data can be manipulated multiple times, either accidentally or intentionally, because I'm trying to maybe be malicious about it. And since it's not been committed to the durable media, it's not under control. So a mistype could be fixed, which is a very valid occurrence. A value could be corrected because maybe it was inaccurate. Maybe I have to rerun it again as an example. Or as regulators fear, a non-compliant result could be deliberately changed in order to meet specifications so I could ship product. All this would be done without detection and documentation in its temporary state. So the risk of temporary memory in a LIMS system or in any other data system that's managing, maintaining records. So the case would be, what if the user types in data and then doesn't hit the save button, which commits it to the database? What if the power gets pulled out of the PC at that point? What if they change it a couple times and they say, I'll forget it, and they just abort without saving? Well, what happens to that data that was originally typed in all those iterations? The answer would be it would be lost because it was not under control. All right, so this became a gap in an area that we concentrated on very heavily. What that meant was, when we talked to our pharma customers, is using systems like Excel. So Excel is probably the most widely used LIMS system in the world, believe it or not, and everybody records information in Excel. The problem with Excel is there is no control around the data entry. There's no metadata, and there's no control, e-cigs, and protecting and audit trailing of the information. I can have procedures in there to control it, but there's no way of enforcing it. There's no process and procedures. The same way with some legacy systems that are on the marketplace today. They didn't have the appropriate controls that were in the system. So, if I can think of a spreadsheet, and I type in that number 4.2, and I go back and change it to 4.4, and I change it again to 4.6, even if I save it into the Excel spreadsheet, those iterations didn't get audited or there was no reason for change and so forth. So in LIMS systems, there's a concept called dynamic auditing of temporary memory. Essentially, we're auditing all user entries even prior to committing to the database, the permanent media, it's called. The system could prompt for a reason for the change, so why are you doing all these iterations? It can also stop and say, can you re-identify yourself with an electronic signature as well? And this should be available pervasively throughout the LIMS platform. Now, what I'm going to do is I'm going to hit a button here, and I'm actually going to show you a little live demo of an example of how we fixed it in our system so you can see live in a real live system. Essentially, what we're going to see here is a data entry page. So I've got 3 samples up here. I've already entered the first result there, 7.8. I'm going to go ahead and move my cursor over, and I'm going to type in a result. In this case, 7.4. Oops, that's an out-of-spec condition. Got a little red X. What I really meant was 7.5. Oops, that's a warning. We're still in spec, but we have a warning issue. What I really meant was 7.9. Yep, that passed. That's the value. Now in this case, I haven't hit the save button there up in the upper left-hand corner, so nothing's been committed to the database yet. And I could actually exit here and nobody would know the difference. However, in this particular system, I can go down to the audit report and I can see all the iterations of the temporary memory that's been audited before it actually gets committed to the database. And that's without hitting the save. I could still stop. The system could ask me why I've done those changes. It could ask me to e-sig those changes as well. But in this case, for demo, I didn't want to have to go through too many iterations. But it gives you an idea of what we're talking about when you're manually entering results into a database system. The other area to constrain and eliminate data integrity issues is with capturing results directly from instrumentation. So instead of manually transcribing a value from an instrument into the database, like we just did a moment ago, instead I hit a button that says get result from the instrument. So in this particular case, I'm doing my weighings here in this case, and I say go get the result, and I say get result, and it gets transcribed right into the data entry page. And then once it's in the data entry page, those same data integrity controls are being enforced to make sure that I may have hit the get result multiple times until I got the value I wanted. It will still record all those temporary memory changes before I commit to the database. So interfacing your instrumentation directly to your systems, avoiding the manual transcription issues, which is not really productive, frankly, and also is not really supportive of data integrity. By hooking them up, you actually are more compliant. The other thing that would help is portable access. So I'm in the lab setting, I'm at the bench, I may have an instrument that can't be interfaced, maybe it's too old or it's just not cost effective. Instead of having that result show up on the instrument and then writing it on a piece of paper and then walking back to my system and then typing it in, it'd be better to have my system really with me right there in front of me. So in my tablet, I could look down and look at the result, type it in on portable technology, and again, eliminate the need for any sort of paper documentation. The goal here is to eliminate paper as much as we can. And again, to remove paper, another aspect is something called electronic laboratory execution systems. So a lot of labs, even those that have LIMS and other lab automation software in place, a lot of them have paper worksheets. They're bench sheets. So I'm performing a method, the technician will have a bench sheet in front of them, and they're manually filling out that piece of paper as they're executing, and then later on they go back and type the results into their system. That piece of paper is still a controlled CGMP record that has to be managed, maintained, archived, and hopefully associated with the original results somehow. In this case, we can eliminate the piece of paper by having electronic forms that are presented to the technician and allow them to perform their assays that way. What's nice about this is that we can enforce procedural conformance to the method execution, which is a good lab practice, and we can also enforce that the information that's required to perform the test is recorded correctly, and there aren't any handwritten legibility issues either. And it becomes part of the record immediately because it's part of the system itself. So how LIMS systems improve overall data management and what to look for with vendors that you may be investigating. One is to look for purpose-built solutions, ones that are intended to meet a specific lab function and have a LIMS platform that offers what manual systems can't offer. A way to capture, organize, analyze the data consistently and across multiple sites. We work with a lot of clients who have multiple disparate organizations, especially in contract manufacturing. A lot of the industry growth is through acquisition, and you start acquiring businesses and trying to bring them in and harmonize them and standardize them. And many in cases, at least in the lab setting, a LIMS system can help enforce that and have it happen. Having the system have the ability of doing direct interfaces to lab instruments is obviously key. It eliminates, in many cases, most of your data integrity issues. It eliminates the opportunity to surreptitiously change the results in the system, and so it makes things very transparent and clear. And a LIMS that's been pre-built for a CGMP environment that enforces data integrity requirements of auditing temporary memory, maintaining audit trails, enforcing approval processes to make sure there's proper rigor and review, and also version controlling of master data so we can manage and maintain records and documents that are actually used in the system are all very important for overall lab management. Systems like this can also contribute to other areas where there's often a lack of documentation, or at least in context. One is the inventory of lab consumables. So keeping track of what inventory of reagents and chemicals and standards I might be using to make sure those chemicals and reagents haven't been expired. They've passed proper QC testing. And then obviously for good lab management, I want to keep track of reordering levels so that I always have enough material on hand to continue my work. Systems can administrate and enforce calibration and maintenance of laboratory instrumentation as well. So many times this is done with paper logbooks or third-party external systems. In this case, this could be all embedded into the one cohesive platform to allow me to manage and maintain the calibration and maintenance of all my instrumentation. I can also keep track of and document the training records of my laboratory analysts. So I can indicate which test methods that they've been trained for or possibly retrained for if there's a new version. And the system can make sure that I don't perform work that I haven't been properly trained for. Again, it's a compliance gap, and it adds to the integrity of the data as well. There may be laboratory investigations. So when results are entered, and let's say there's an out-of-trend situation or an out-of-specification situation, the lab is required to investigate the reason for that. So the system, in this case, can initiate an investigation. That investigation has a life cycle. There may be an outcome that has been observed, and then we can decide if those results can go forward or have to be reworked again or invalidated. And the full documentation of the CAPA process, in the lab level at least, would be managed and maintained. In the research setting, again, there's a lot of paper and research. A lot of times there's paper lab notebooks. They can be completely eliminated, and again, they can then take advantage and benefit from good lab practices and documentation practices by having electronic lab notebooks instead. And then we can also hook up to other business systems that are adjacent to a LIMS system in the manufacturing world, like MES systems, electronic batch record systems, manufacturing resource planning systems, and so forth, to make the process go faster and make the information flow electronic instead of manual or paper-based. So to really sort of summarize, as pharmaceutical and biotech companies, as they race to develop ever more advanced and more complex chemical entities and formulations, the pressure is growing to operate more productively and cost effectively. So obviously, not only is compliance important, but speed and cost is a factor in our industry. Guidelines for data integrity, newly refreshed for the modern world of data collection, demand a whole lot more transparency and accuracy. So no longer are you able to rely on paper documentation, Excel, or custom homegrown systems, which we still see quite a lot of. Modern companies are really abandoning a lot of their traditional paper-based solutions or their old legacy systems to modernize and harmonize. And they're doing that in favor of a pre-configured, pre-validated LIMS that's built specifically for the requirements of their lab today.